Two major factors are contributing to the growing incidence of osteoarthritis. You've heard about it, arthritis. One, the aging population, and two, obesity, resulting in increased stress and wear and tear of the joints over longer periods of time. If you're a woman, you're at greater risk. If you have injured a joint or joints previously from trauma, an accident, or maybe due to sports, you're more at risk. Genetics play a role, but we don't really know exactly how it interacts yet with our body. The prevalence of osteoarthritis increases dramatically with increasing age. Kind of makes sense, right? We are sophisticated machines, but like machines, we break down. Osteoarthritis is chronic, it's progressive, it's often debilitating. It affects not just the joint per se, around the joint, but everything that's around that joint, the ligaments, the muscles and tendons. Osteoarthritis can be very frustrating for patients because it can significantly interfere with active lifestyle. Ideally, non-drug therapy should be implemented first. Try to stay away from drugs if you can, unless the disease gets really bad. When it's mild, don't do that because you're going to need it later on. These therapies can include exercise, weight loss, physical therapy, braces, and other orthopedic devices. Drug therapy should be considered for people when you're really starting to get more severe. Today, I want to start a series about what natural treatments you might use, and I'm going to mention boswellia, or Indian frankincense. Some pretty good clinical research shows that taking Indian frankincense extracts can reduce symptoms of osteoarthritis, and in 2 clinical trials using a 100 milligram daily or 250 milligram daily dose, they significantly improved pain and functionality scores in patients with osteoarthritis after 90 days of treatment. Note it takes longer than it does for prescription products to get going. The pain scores, though, were reduced by 32 to 65%. That's impressive. Patients began to have significant improvement within 7 days of treatment. The extract used in this study was standardized and enriched to contain 30% of the boswellic acid. As I've often said before, there's no standard for nutritional supplements, so take careful note of what I said. 30% boswellic acid. It should be probably on the container. And my next installment is going to talk about yet other options to treat arthritis, like devil's claw. But let me just make one quick last point. Natural products, as I have said, take longer to work, but they have fewer side effects that may be worth it to you. This is Dr. Sam Benjamin with medical news you can use.